Good morning, dear students. I welcome you all back to the class. Let's discuss the last part of carbohydrate metabolism today. Hope you all have learned the pathways coming under carbohydrate metabolism. Let's move on to the final content of carbohydrate metabolism now. The subtitles under carbohydrate metabolism part 6 are hormonal regulation of blood glucose level and diabetes mellitus. Blood glucose is nothing but the carbohydrate present in our body, in blood. How this blood glucose is regulated through hormones, through metabolic pathways. How it is maintained, the normal level of blood glucose, how it is maintained, and what are the disorders when abnormal levels of blood glucose is present in the body. That is going to be discussed today. So what are the titles? Hormonal regulation of blood glucose level and the disorder associated with carbohydrate metabolism, that is diabetes mellitus. Coming to hormonal regulation of blood glucose level. What are the hormones involved in regulation of blood glucose level? Blood glucose level is increased by glucagon, epinephrine, cortisol, ACTH, growth hormone and thyroxine. These are the 6 number of hormones will increase blood glucose level, where insulin and somatostatin are decreasing blood glucose level. These only 2 hormones will decrease the blood glucose level when it is raised in the body. So what are the hormones will decrease? Insulin and somatostatin. Let's see what is the mechanism involved in regulation of blood glucose level. There are mainly 2 hormones involved in controlling blood glucose. They are glucagon and insulin, where other hormones will influence these 2 hormones to control the blood glucose level in the body. So let's see what are glucagon and insulin. Glucagon and insulin are synthesized from pancreas. Alpha cells will release glucagon, where beta cells will release insulin. When glucagon is released at low blood glucose level, when insulin is released at high blood glucose level. When low blood glucose level, pancreas will be indicated to release glucagon. Thereby, in the liver, more amount of glucose is released to control the blood glucose level to normal condition. At high blood glucose level, pancreas is indicated to release insulin from beta cells. Thereby, glucose is utilized by the fat cells, so that it brings blood glucose level to normal. Thereby, these 2 hormones are playing main role in controlling blood glucose level in the body to normal level. So this is the mechanism involved in regulation of blood glucose level in the body. Coming to the second part, that is diabetes mellitus. What is diabetes mellitus? It is a group of metabolic diseases and related to an endocrine disorder characterized by increased levels of glucose in the blood. Increased levels of glucose represents hyperglycemia, resulting from defects in insulin secretion, insulin action, or both. And it is caused by abnormal insulin production and impaired insulin utilization. It is caused by abnormal insulin production and impaired insulin utilization. This is about diabetes mellitus. It is a group of metabolic diseases related to an endocrine disorder characterized by increased levels of glucose in the blood, resulting from defects in insulin secretion, insulin action, or both, caused by abnormal insulin production and impaired insulin utilization. Let's see what are the types of diabetes mellitus. There are three types: type 1 diabetes, type 2 diabetes, and gestational diabetes. How many types? 3: type 1, type 2, and gestational. What is type 1 diabetes? It is due to damage of insulin producing cells of the pancreas, mainly beta cells. What is type 1? How it arises? Due to damage of insulin producing beta cells of pancreas, and it occurs in people who are under age 30. Coming to type 2 diabetes, it is nothing but adult onset diabetes. Adult onset diabetes. And type 2 occurs most often in people who are over 40 years old. What is gestational diabetes? It occurs during pregnancy. And those who have a history of polycystic ovary syndrome, PCOS, will be having gestational diabetes. Here the picture represents the types of diabetes mellitus. And what is the mechanism behind type 1 and type 2 diabetes? A healthy person will be having insulin release from pancreas in the normal way, and glucose utilization and insulin binding with the cells also normal way. During type 1 diabetes, the pancreas failure to produce insulin only. So glucose uptake is restricted, thereby glucose level is increased in the body. That leads type 1 diabetes. So what is the case of type 1? Pancreas failure to produce insulin. What is type 2 diabetes? Insulin is produced from pancreas, but insulin utilization by the receptor will be restricted. So cells fail to respond to insulin properly. Thereby glucose utilization again is stopped, so that glucose level in the blood is increased to lead type 2 diabetes. This is the mechanism of type 1 and type 2 diabetes from healthy person. What are the causes of diabetes mellitus? Injury to the pancreas, autoimmune disease, age, physical stress such as surgery or illness, high blood pressure, abnormal blood cholesterol or triglyceride levels, smoking, being overweight, use of certain medications including steroids. So these are the causes that leads diabetes mellitus. What are the symptoms of diabetes mellitus? Increased thirst, increased hunger, dry mouth, frequent urination, unexplained weight, weak and tired feeling, blurred vision, numbness or tingling in the hands or feet, slow healing sores or cuts, dry and itchy skin, frequent yeast infections or urinary tract infections. These are the symptoms of diabetes mellitus in common. Let's see the treatment methods for diabetes mellitus. There are 5 kinds of treatment procedures for a diabetic patient. In the beginning, it is treated with nutritional care by following proper diet. Then the dosed physical activity is done by the diabetic patient, like aerobic and resistive exercises. Thirdly, phytotherapy using the below mentioned plant species. Then next, the treatment is done with oral hypoglycemic agents like sulfonylurea preparations of primary and secondary generations, then biguanides, etc. And lastly, insulin treatment. So as per the last slide, this picture represents the stepwise treatment for diabetes mellitus. So how we are managing the diabetes mellitus based upon the severity. Firstly, diet and exercise, then oral monotherapy, then oral combination, then oral plus insulin, then only insulin. Let's move on to the methods to diagnose diabetes mellitus. There are 4 tests available to diagnose diabetes mellitus. What are those? HbA1c, fasting plasma blood glucose level, then oral glucose tolerance test, then random plasma glucose level test. In the second column, the cutoff for diabetes. If the levels represents at this level, the patient is having diabetes mellitus. For HbA1c, it is in percentage more than or equal to 6.5%, then it represents the presence of diabetes mellitus. Likewise, 126 milligram per deciliter for fasting plasma blood glucose, then more than or equal to 200 milligram per deciliter for oral GTT test. Then for random plasma glucose level, it is also more than or equal to 200 milligram per deciliter. The third column represents procedures for each test, how it is carried out as given. Just read and go through the points, how it is done. HbA1c is done and the results will give whether you had diabetes mellitus for past 2 to 3 months. Okay, and this is the common test nowadays to detect diabetes mellitus, whether the patient is having diabetes mellitus from 3 months earlier. Then second test is fasting. How long we need to take fasting? At least 8 hours. Then oral GTT, orally glucose solution is taken to analyze how it is utilized by the body. After 2 hours the test is done. For random blood glucose level, it is done at any time, either before meals or after meals. Means no need of taking fasting also. It can be done at any time with diabetes mellitus. So these are the 4 tests to diagnose diabetes mellitus. The blood glucose level for normal, pre-diabetes and diabetes conditions are given here. When it is diagnosed by HbA1c, fasting plasma glucose and oral glucose tolerance test. By HbA1c test, normal level is approximately 5.7%. For pre-diabetes, it may extend up to 6.4%. For fasting plasma glucose level, normal diabetes or normal person will be having less than or equal to 99 milligram per deciliter. During pre-diabetes, the range will be from 100 to 125 milligram per deciliter. For oral GTT test, normal level is less than or equal to 139 milligram per deciliter. For pre-diabetes, 140 to 199 milligram per deciliter. For diabetic conditions, already we have discussed in the last slide, like 6.5, 126 and 200 milligram per deciliter respectively. With this, we are coming to the end of discussion on carbohydrate metabolism under Unit 2. In the next class, we will be discussing about biological oxidation in the Unit 2. Next topic is biological oxidation. In that part 1, we will be discussing in the next class. Hope you all have learnt clearly about carbohydrate metabolism. Thank you all.